It's been a while now, and I am very excited to be back live. We are on Facebook and on YouTube. The last time we were here, we looked at maternal diabetes with a focus on gestational diabetes with Mrs. Angela Ankuma, and it was an extremely insightful session. So I hope tonight is going to be wonderful as well. We have sort of captured a few bits of cancer in previous sessions, but tonight we are going to focus again on the female reproductive organ. We are going to be looking at cancer, the causes, treatment. Is there any solution at all when you are hit with this diagnosis of cervical cancer? We are coming your way, and if you want to watch this, you can go on Facebook and on YouTube. For those of you who will be joining in on YouTube, of course, I can't see your questions, so please kindly try and channel any questions to my guest through Facebook, and I'm sure we are in the right place at the right time, because tonight I have a very charming young lady. She doubles as my twin, actually, and she will be taking her time to look at cancer. So, Mrs. Araba Asmakujo, you've been here before, so let me welcome you once again to Let's Talk About Health. And I'm your host, Mrs. Winnie Ohinekisi. Thanks for tuning in, and keep watching and keep sharing as well. So, welcome, Mrs. Kujo.
Thank you.
We have looked at cancer before, when I started the show about 2-3 years ago. But tonight I want us to recap. In the news following COVID, we hear a lot about cancer cases going up and about delays in treatment. Should we be worried? What is the statistics generally about cancer as a whole and about cervical cancer actually?
Cancer is going up, because the causes of cancer, the first cause is unknown. So we really don't know what is causing cancer, but there are some factors that attribute one to have cancer. When we did the first session, we talked about the cell. We know that the cell is the basic unit of life, and we have something called the cell cycle. How the cell, they grow, how they mature, how they divide and everything. So cancer happens when these cells grow abnormally. So we'll say it's like the traffic light of the body. When the cells are growing, there's a system in the body that tells them, you've grown enough, don't grow again, or stay here, let somebody else grow, or die. Or you've got to a point you need to divide. And some of the cells are rude. They don't listen to the traffic light of the body, so they just grow and grow and grow, and that's when cancer happens.
Right, I see. So generally, how do we define it then, cancer?
So cancer is an umbrella term of abnormal cell growth.
Right.
It can happen anywhere.
It can happen anywhere.
It can happen
in the body. Right.
Anywhere.
We want to focus on cervical cancer tonight, but I want people to just have a brief idea of generally what cancers embrace. Are there any types of cancers? Then we will look at cervical cancer as a topic. So, what are the types of cancer?
We have 5 types of cancers. We have sarcoma, which is a cancer of any tissue, can be the breast, can be the lung, and we have leukemia, that is the cancer of the blood, and then we have melanoma, that's cancer of the skin, and we have lymphoma, cancer of the lymphocytes and the lymph nodes, and then we have sarcoma, that is cancer of the connective tissues.
Okay.
So, which means all these things are in our body. So it means cancer can happen anywhere in our body.
Right. So when we focus on cervical cancer, which type will it fall under?
Cervical cancer is a sarcoma because it's a tissue. Our cervix is a tissue. So sarcoma.
Right. I would have asked about the treatments of cancers generally, but I think I'm going to reserve that because I'm sure it will probably cut across all types of cancers, isn't it? So now let's focus on cervical cancer. I mean, a lot of the people who view this have been very interested in this topic, especially because we've had a little break, but more so because, I mean, we hear these things coming up a lot. And should we be concerned, especially our black ethnic minority group, should we be concerned?
Yeah, especially women, because every woman has a cervix.
Yeah.
And the lifestyle of us women also predisposes some of us to cervical cancer. And there are some who the cancers are in the family already. So those people have a thing there that they have a predisposition. And there are things that some of us also do that will predispose us to cancer.
I see.
Cervical cancer.
To cervical cancer. I mean, when you mention about predisposition or family history, should we be worried? Like, I have had someone in my family have cancer in the past. Should I generally be worried about all cancers, or should I be worried when it's a particular cancer which actually was suffered by a family member?
In actual fact, we should be worried about all cancers these days, the way things are going, because the cause of cancer is not known, it's unknown. But these predisposing factors are there. So we have to be worried about all cancers. And especially women, we're talking about cervical cancer because it pertains to women. When we talk about prostate cancer, it's pertaining to men. So I wouldn't worry about prostate cancer because I'm not a man. And no man will also be worried about cervical cancer because he hasn't got a cervix. So it depends on what you are, who you are, and what you worry about. But cancers like lung cancer, skin cancer, we all have lungs, we all have skin. So definitely it can happen to a man, it can happen to a woman.
Right. So if you are a woman, you have children who are women, young girls, you should be very interested in this very topic because I'm sure it can cut across all ages. Exactly. I know people who have been very young and yet have suffered cancer. So, I mean, it is always interesting when I do these topics because I want us to go to the anatomy, look a little bit about the anatomy of the female reproductive organ, because when we mention the cervix, you'll be surprised where people could potentially point to. So if I could have the producer just project and we have a look at where exactly we are talking about, the cervix. If we can have a look at the diagram which shows the cervix on the screen, so we can look at all the female reproductive organs and with the cervix in focus. So if you want to start like a brief description, what we...
the cervix is the gateway to the uterus. The uterus is usually, we call it the womb. The womb is where the baby grows. That's if you take a balloon, the bigger part of the balloon is the womb. So that thin cylindrical shape is the cervix. You see where the vagina is, and it goes to the cervix. So women, when we go into labor, the midwives will be telling us 2 centimeters dilated. That is the cervix opening. So if the cervix is 2 centimeters dilated, it means the cervix is opening until it gets to 10. So the cervix is the gateway to the uterus. Right. So if you want to go into the uterus, you have to pass through the cervix. So we are talking about the cervix, which is the gateway. Cancer happens at the entrance of the cervix, of the uterus.
Yeah. Right. So it looks like an inverted bottle.
Exactly.
Yeah, and I guess the cervix will be like right at the tip.
At the tip. That's where we drink from, the tip of the bottle.
Of the bottle.
Yeah, that's the cervix. Yeah.
Okay. I mean, this is not a part of the body which is exposed for everyone to see, isn't it? So how do women actually know where their cervix is or feel for it, for instance?
Usually, because it's hidden, how we can find our cervix is whenever we are having our bath, and then you squat to clean yourself, wash yourself. Usually water is very good to wash. You can just one finger just into your vagina, and then as you are washing, you can feel the tip there.
Yeah.
When you are menstruating, it becomes a little bit puffy because it is filled with blood that is coming out. But then when you are not menstruating, you see that it's not too puffy, but you can still feel the slit, the opening there. So you can just run your finger around it. Sometimes you can feel a growth, tiny growth on the tip. Right. Sometimes you can feel nothing.
I mean, so, it's interesting you say this. It comes down to examination.
Exactly.
And usually the first person to actually pick up on something going wrong is the individual themselves, isn't it? But later on, I'll say why I'm quite concerned because of some of our practices these days as women. Yeah. So you are advising us to go down there, go into the vagina, feel around it, and see what should they expect? How should it even feel like?
Yeah, normal cervix is very smooth. You won't feel any growth on there. But then if you put your hand in, your finger actually, if you put your finger to the tip, and maybe you feel tiny like you've got rashes on your skin. If you feel anything, tiny growth at the tip, you have to be a little bit concerned. You have to report it as soon as you have to see the doctors.
Right. These days, women like to slay. Let me put it that way. Yeah. And I am particularly concerned, you know, so because of all the things that we say when it comes to health talks and everything about examination, feel for this, feel for that. But now our general practice is to slay having all these nail extensions and, you know, like really long, like fangs, very long nails. Is there a way of actually examining ourselves with these?
That is the thing, because with such nails, you know, don't forget that this the uterus connected to this is a muscular organ, and it can bleed easily. It bleeds, it won't stop. So imagine with that nail going in there, you can even cause bleeding yourself. So sometimes I really don't know how you can use those fangs, as you've said, to examine it. But with your normal finger, with your normal nail, I think you can feel it. But I really don't know how. We need to learn. We have to stop these practices. Once a while, it's good to look good. But if it's everyday practice, then I think we are missing something somewhere.
I had a patient here who talked about examinations for breast cancer, trying to feel for a lump in your breast. And this is almost in line with what she said, feeling for things down below, which is more difficult to do. You see, so I was just wondering, like you go in there, is there, apart from the rashes, is there anything else? Like,
you know what, with cervical cancer, most of the time the signs and you don't feel any signs and symptoms
at all.
Nothing. Most of the time they don't feel anything, but then there are few things that you can something is wrong. You might be having discharges or bleeding, even not when you are not menstruating, or even after menopause. Or bleeding after sexual intercourse, and sometimes the bleedings are a bit heavy. So these things are just an alarm ringing to tell you something is going on. So you need to check them.
I feel that generally women are quite used to seeing blood.
Yes.
You see, so unless it's a lot, it's usually not going to alarm. Doesn't matter how much bleeding there should be before anybody.
But then, let's say you finished your period and then suddenly you are bleeding again, even if it's tiny, or you've had sex and you are bleeding after sex. You have to. It might be nothing. But you have to report it. You have to make sure. Or let's say somebody who is in menopause, and then suddenly that person is bleeding. It should ring some bells for you that what is going on. I mean, why am I bleeding? You need to. Or sometimes somebody might feel a little bit of abdominal pain, which is not due to anything. Or sometimes we might have discharge with some foul smell that you're thinking, something is going on. So all these things are alarm bells ringing that you need to do something about.
Right.
It might be nothing. It might be just an infection. But because it's hidden where it is, if something is spreading, it's very difficult to catch up. So you need to be very particular if anything is not right.
Okay. Right. In preparing for this, I read around the subject, and so in case of cervical cancer, there seems to be a cause, which actually leads one or predisposes one to. Yeah, and if you can tell us about that.
Mostly is sexually transmitted disease called HPV, humanopapillomavirus, and this virus can be only transmitted through sexual intercourse.
I see.
And most of the time, most of us women get this HPV infections, but our body fights it off. But some people are not so lucky, the body doesn't fight it off, and then it becomes cancer. And especially people with multiple sexual partners, they are much. And as Africans too, we are fond of inserting things. Oh, we need to tighten the vagina. But don't forget the cervix is also hanging in the vagina. So you are tightening the vagina. Whatever you are putting there, we don't know what. It might be something else and it can affect the cervix. So putting all these things there might not be very helpful. It might help some people, but it might not help some people. And then smoking as well, heavy smokers. It also reduces your immune system. So definitely, if anything hits you, it hits you hard. And then suddenly losing weight so fast. You are not sick, but then you can see you are losing weight. All these things are contributing factors. All these are things that you need to check. Maybe something is going on. It might be nothing, but you need to check. Or bleeding suddenly. You are bleeding all the time, you are bleeding. Or you have sex, you are bleeding. You haven't even had sex, you are bleeding. These are things that as women, we should be alarmed when we see such things going on.
So even though the general causes of cancers are not known, in the case of cervical cancer, you mentioned about this HPV. Can it be treated?
It can be treated if it's seen early.
Okay.
But because cervical cancer normally doesn't give any symptoms, some women don't realize what is going on. So they tend to go when the cancer has advanced a little bit.
Wow. Which will not be helpful to anyone, isn't it? Right. So looking at this, how quickly can we pick it up? And does it go in any stages or, like cervical cancer?
Yeah, as I said before, cancer is diagnosed in 4 stages. Stage 1, stage 2, stage 3, stage 4. Stage 1 will be the cancer just at where it started in the cervix.
I think we have a nice diagram to go with it, isn't it? So if we could have
that diagram,
that as well, that will be helpful. Yeah.
Stage 1 will be just at the cervix. Stage 2 will not be just around the cervix. Stage 3 will be going to the uterus. And stage 4 is when it has gone into the uterus, the fallopian tube, the ovaries, even into the vagina. So stage 4 is when it has even gone into other organs.
Yeah.
And even onto the bones.
Yeah, so we have this very nice picture.
So if we look at the first one, it's the normal cervix. And early stage 1B, there's a cancer tissue there. And then when we go to stage 1B, you see how the tip of the cervix is. You can see cancer cells are there. And look at stage 1B. You see the cancer cells are going up even into the uterus.
Right.
You see? So these are the stages. The first stage is a normal one. The first stage is the cancer has started, but it's still in the cervix. It hasn't gone anywhere. So if that person is so lucky and this is caught up early, it can be treated.
Will we be able to feel for this at this early stage? Or at what stage?
You might not feel it when you touch it. Because when you go to the doctors and they do whatever test and they find this stage, what they will have to do is they're going to take a biopsy. They take a tissue from the cervix to look under a microscope. And this will tell them, there are cancer cells there. So this is very early stage. So whatever treatment plan that they will give, they will discuss with you, and they will start treatment. So is stage 2. Stage 3-2 is the same, which has gone up. So stage 3-2 you have chemo, but stage 4 is a cancer that has advanced to other organs and even into the bone. That's when we say it's you've got meds. So with that one, stage 4 might be only be the chemo or whatever treatment will be given for palliative, for the relief of pain. It's not going to cure the cancer because it has advanced.
I mean, looking at this, it may be very difficult for the individual to sort of pick it up early. Yeah. Are there any other signs and symptoms that can help?
Yeah. With the early stages, it's very difficult. But then in the UK here, we are offered yearly or 2 yearly pap smears that you need to go to your GP to do. That is when I said, if you feel anything, sometimes they sit and they feel pain at the early stages. Or they might have abdominal pain. They might have unusual bleeding, even they are not in their menses. They are bleeding. They have sex, they are bleeding. And discharges, and it's smelly. All these things should tell you something that you have to seek help. Because if you don't at that time, by the time you go, it's going to be in a different stage.
Yeah. Interesting, this bleeding, coming up bleeding, especially bleeding during sex.
Yeah.
And I remember having a conversation with one young woman years back, and they kept saying they are bleeding a lot, especially after sex. I mean, generally we don't like talking about sex. It's very private, which is understandable, but obviously they confided in me, and they kept saying that. And I said, okay, it was troubleshooting to see if there was anything to pick up. And then she lifted her armpits, funny enough, and I saw a lot of hair. You see, so I was wondering, I said, you have to find a way as a health professional, isn't it, having some of these difficult conversations. So I was thinking, if this is how much hair up here, I'm just wondering how much. Does it have an effect at all? Because funny enough, I mean, it is funny, but these are very, very tiny things that can help, isn't it? So advice there, I said, look, let's start from basic things. Maybe there is nothing much going on.
Exactly.
But then if we could do, it could just be a little bit more, hairs down below. So try getting rid of it, and let's see how it goes. Now, months down the line, I had forgotten about this conversation, obviously. And she comes to say, it helped. It was the hair. And I thought, what are you even talking about? And she said, yeah, I shaved, and it's the bleeding stopped, magic. And I said, oh, okay. Can it cause danger? Because it's sex and hair, and some people generally like to keep themselves this way. What do we advise the women to do?
In actual fact, whether you want to keep your hairs or you want to shave it off, it's the person's choice.
It's the person's choice.
But then, because where our cervix and our vagina is, we need to keep it clean. So whether you keep your hair, whether you not keep your hair, washing should be a normal thing for a woman. You have to keep the place clean, because any infection that goes there is going to attack everything else.
Right. Yeah. And then let's come to the pap smear. How often are we expected to do the if you haven't had one? Do you ask for it?
If usually the GP starts, I think, when you are 20 years old or just before.
As early as that.
Because now even kids get cervical cancer, unfortunately.
Really?
So there's been, when we come to the treatment, they've created a vaccine for young girls to have to prevent it before they get to start having sex.
A vaccine against the virus we are talking about,
against having the HPV, so that they don't end up having cervical cancer. But then all these things are the pap smear. The GPs will call you to go for pap smear. So if you are a woman and let's say a year or two you haven't had any pap smear, you need to get to your GP, because they check all these. They take the smear to go and check to see if there's anything going on.
Yeah.
If there's any abnormal cells growing in the cervix. If there is, they will tell you, and they will start doing some tests to make sure it's nothing. But if you haven't had the pap smear and something is happening, you wouldn't know.
Right. So we have already started looking at diagnosing cervical cancer. Is there anything else to expect with the diagnosis?
It's usually with the pap smear
just
that they
with
will
the
find.
Pap smear.
If you do the pap smear, they will find it, and they will do a HPV test as well. If it's positive and there's a cancer cells in there, they will also tell you. They will take a biopsy and they will tell you what is happening, and then
wow.
Treatment will be started.
Treatment will be started. The conversation is getting more and more interesting. And like I said, we are live on Facebook and on YouTube. So if you haven't joined us or shared with a friend, please do keep sharing and let's get all the knowledge out there. It's just the basic little things which go a long way to make a very big difference. So now let's start looking at your treatment options. I mean, in your daily job, you have very, very difficult conversations. And whenever cancer is mentioned, it will start with a very difficult conversation, isn't it? How do you even break the news?
It's very difficult. Breaking the news is very difficult because whenever anyone hears the word cancer, some will tell you, my life stopped for 5 minutes. And it's very true because we have attributed death to cancer. As soon as they diagnose you with cancer, everyone knows, oh, you're going to die. Especially from where we come from, part of the world we come from. As soon as they hear the word cancer, oh God, I'm going to die. But that's what I said, depending on the stage of the cancer, depending on the symptoms that you are having. If you go early and they catch it early, it's treatable. But then if you wait till it gets to the end stages, when it's gone into the bones and other organs, that's when it's not treatable. So it's a very difficult thing to break such news to patients. So sometimes when they come in, they have to come with a relative because whatever you say goes in this ear and goes out. So if a relative is there, even it's very hard for the relatives as well, because come on, this is my wife or this is my mother that you're giving such news to. So it affects me as well. So sometimes they will go back home and ring again and ask, what did the doctor say? And you don't blame them because it's hard. Even as the nurses listening, it's not easy for us. It's very hard.
It's not easy. So what should they expect? Like on the very first meeting, and I guess there will be a whole team there to break this news. It's not just you, the practice nurses, isn't it? What should they expect?
Yeah, when they come in, the consultant who is going to break the news is there, and there's a specialist nurse in there with them and the relatives. So the doctor will tell you, when we did your biopsy, we found some cancer cells. And they will tell you what stage it is. And they will tell you possible treatment that will be available to you. And it's your choice to go for whichever treatment you have. They will suggest the treatment, but then the option will come from you. And the doctors will also make sure they liaise with you. They're not going to force any treatment on you. I think this treatment will work better. So let's say if they give you treatment A and treatment A doesn't work, they can move to treatment B.
Right. So just from the pap smear that was done, they are able to identify the stages, or you have to have further investigations.
After the pap smear, let's say they did the pap smear, they found that they've done the biopsy, they've seen it. If they find cancer cells, they will do blood tests, they will do CT scans, they will do MRIs to see if the cancer has gone to other organs. They will do blood tests as well to check pelvic MRI, abdominal scans to see where the cancer has gone to. Luckily, if it hasn't gone anywhere and it's just in the cervix, hooray. And then treatment is started.
I get, so all this intensive kind of investigations will start
done
after,
before the doctors call you to tell you what has happened.
Even before?
Yes.
Oh, okay. So you shouldn't be too worried then.
No.
If you are being called for these tests.
It's worrying when they call you back. You know, when you do such tests, and they call you back, definitely you know something is wrong. So they come in, they know what's happening. So sometimes as soon as the doctors tell them, when we did your biopsy, I think we found some cancers. I said, yes, I knew. Because I could feel it in me.
Yeah. And this is just the true response
that is exactly
the patients who come in.
Yeah.
Wow.
Yeah, it's hard.
So let's carry on with the treatment. I mean, surely there must be options that an individual can choose. Yeah. So if we can start from any basic
all cancer treatment, we have chemotherapy that can be given intravenously, intramuscular.
Regardless of what stage of cancer it is?
Yep. Intramuscular, subcut under the skin, or oral. You can have radiotherapy.
Yeah, I mean, I think we will probably take time and go through the different treatment options.
Yeah.
So the first one is chemotherapy.
Yeah.
And you definitely have to have chemotherapy.
It depending on the stage, yes.
Right. Yeah. So if it's just at the initial stages where it's gone nowhere, just at the tip of the cervix.
Sometimes they will do radiotherapy. Okay. Radiotherapy is exposure of radiation to the part of the cervix where the cancer is found. It can be done internally into the cervix, or it can be done externally. So that's one.
I see.
Or stage 1 to you can have chemotherapy, depending to catch it fast.
Yeah. Right. So if it's gone to other places, then we move on to chemo.
Yes, definitely. You're going to have chemotherapy.
Yeah.
And that one definitely is going to be intravenously, because it's going to go through the body to the cells.
Okay. And every cancer patient has to have it?
Yes.
Wow. That's really a lot to take.
Yes.
Yeah. If I could have checked to see if there are other people who have joined us, but this is really like full on. Are there any survival stories at all?
Yes.
We will continue with the treatment, but if I am a patient who has just been called in for one of these sessions to be told about it, I want to know whether there can be any outcome, because I know the treatments are really rigorous. Yeah. Are there survival stories?
Yes, there are. That's what I said. Cancer treatment survival depends on the stage it was caught.
Right.
If your stage 1 is very treatable, stage 2 is even stage 3, you can go into remission, but the cancer can come back. But stage 4 is when it's either palliative. That's when it's going to be relief of pain, because stage 4, don't forget, it has gone into other organs, and it has even gone into the bones. So such person will be in pain everywhere. So the treatment option will be for only to relieve the pain, not to treat the cancer or to cure the cancer.
This is so much to take. So let's have a breather and see. A number of people have joined us live on Facebook. I know some of you will be watching through YouTube, because there are a number of people who are just not on Facebook. So let's see. And this aspect always excites me. And let's see who is here. So Abba Jacobs is here, and she's just saying Aku is in the house. Dr. Bright Jampo, he's one of the obstetricians with Trowbridge Foundation, who is always supporting me on the show and doing a lot of activity. And for those of you who have watched previous episodes, I'll say stay tuned, because I'll be telling you so much about what is lined up for later on in the year. So Dr. Jampo is saying, I like the description of the cervix, the gateway to the womb. Nice. And he also says, persistent bleeds after intercourse is therefore a red flag.
That's it.
Persistent bleeds or bleeding in between periods require checkup. You see, I find that so interesting, because a lot of women, let me focus on our women, especially about 50 years. Yeah. When I have conversations with them and we talk about sex, They are like, oh, well, are you still doing that? Okay, so a lot of women, and this is serious, you know, and I've spoken to people from black backgrounds, I've spoken to white women, and they all seem to stop doing certain things. It's almost unthinkable. Sex. But I mean, I'm gathering that it is so important, isn't it? It is an activity of daily living, and I'm sure by now the men watching will be really like into it.
Yeah.
You see, because how do you diagnose yourself, or how do you even raise this red flag if you are not engaging in sex? How do you?
I think when when we get to menopause, because our libido and everything goes lower, all the hormones have gone lower, the drive is not there.
The drive is not there.
So that is why I'm thinking these women are saying, oh, do you still do that after 50? But then, come on, life must go on.
Trust me, if there was any time to be doing it more, you don't have any pregnancy to think about. So come on.
This is the time to have it more.
I think one day we have to just talk about like sex education and everything on this platform, because who knows? We could be diagnosing ourselves. So we certainly cannot stop doing this.
No.
Yeah, so that is just by the way. So that Dr. Jampo, bleeding, if you are bleeding during or after intercourse, it's a big red flag, so you have to look out for it. Hannah Blaze says this is very great. I'm not sure which one exactly, Auntie Hannah. Elizabeth Jechi, Catherine Boche, and 3 other people are watching. I mean, they were our mates in nursing school, so that's great. Big sis AC Hammond, who is always dressing me up, you know, all these gorgeous outfits, is watching. Benny Harrison says well done. And Dr. Jampo says again, Auntie Winnie, can Judith shed some light on vaccines to prevent cervical cancers? When should our daughters get the vaccine? Can any woman get the vaccine, or only those who are pre-sexual? That's a very good question.
It's they made the vaccine for the girls to have them before they start having sex.
Yeah. Before they start having sex.
Yes,
right.
They wanted to catch them, give them the vaccine, not catch them literally.
Catch them young.
That age group, when they are young, give them the vaccine before they become sexually active. Because, you know, when they get to that age, they become so active that they tend to have multiple sexual partners. And this is what exposes them to these sexual transmitted diseases.
Yeah.
So the HPV is the vaccine is there for the young ones and anyone who wants to have it, and those who have the cancer in their families as well. With cancer runs in their families, so these vaccines are there, and girls must have them.
You see, come to think of it, I mean, obviously we came to live in this country when we were more mature, but I don't think I've been offered like an HPV vaccine, and
that's why you have to go for the yearly pap smear,
which I do.
Yes,
but it has to be yearly.
Yes, yearly or 2 yearly, depending. It depends on your. If the doctors have done you for so long and they don't see anything, I think instead of yearly they move to 2 yearly. So if let's say 2 years and you haven't had a pap smear, when COVID happened, everything stopped. So most of us haven't had pap smear in 2 years.
Yeah.
So this is the time we should be ringing our GPs to book an appointment to go for them.
Yeah. Okay. So Elizabeth Jechi is saying this is very educative. Well done, Aku and her student. I'm not sure whether I am the student or you are the student, but Malizi, that's very well noted. So AC Hammond is saying sex is not a comfortable subject for Africans.
Exactly.
So there must be a subject that brings sex on board all the way. Yeah. You see, and I find it easy, obviously because of the job we do.
Exactly.
I find it easy to bring it up. Yeah. But sometimes, even within your close circles, like big sister asking this, I don't think I have that kind of conversation with her at all.
Yeah.
But I can say it live for the whole world to hear.
Yeah.
You know, why should we be having these conversations?
Yeah, it's because of the part of the world we come from. Because sex is, in our culture, sex is between a grown man and a grown woman.
Yeah.
So even if you are young, let's say even if you are 20 and you are not married, it's a taboo to say I'm having sex or I've had sex. You hide it. You have to hide and have sex.
I mean, so not so much anymore. You'll be surprised,
exactly.
You know. But when we were growing up, 100%
that
was the case.
It's never mentioned.
Yeah.
You don't until you are married. Then you can have, even that your mother will not teach you anything about sex. You have to learn it from friends and even your sisters, big sisters. I had big sisters. I'm the youngest, but none of them taught me anything about sex.
Yeah.
I had to, and luckily for me, I went to nursing, so I had to learn everything.
Yeah.
You know, so it's a taboo in our culture to talk about sex. But these days it is taught at schools, even in primary school, they are taught, because these days the children are very adventurous. 10 years, 11 years, they want to have sex.
Yeah.
So it's taught at school for them to know what to expect. So if you are 10 years and you think you are sexually active, you should go for the vaccine.
You should go for the vaccine. And it's obviously been tried, tested, and it's safe for our girls, because one thing Africans will always think about for the future is having children.
Yes.
Can the vaccine affect them having children at all?
It doesn't.
And that's evidence-based, right?
It's evidence-based, yes. It wouldn't affect them having children. Yeah. It would prevent them having cervical cancer.
It will prevent them. So it's an absolute must. And I have Benny Harrison. She's saying, I remember my girls were offered in secondary school. Obviously, her children grew up here in the UK. So they would have been offered it. Marta Koba says, I'm enjoying, very educative. Yeah, so now I want you all to start sharing, keep your questions coming in. The feed here is a bit like on the slow side, so sometimes your questions don't trickle in till a bit later on. But if you want to ask more questions, even when the show is over, you definitely can direct and link up with me or through Omega Live TV, and we will definitely get back to answering your questions. And all this is coming to you by courtesy of Omega Live TV and Omega House Multimedia. And if you want to know what we do, you can find us in Wood Street in Walthamstow here in London. And they do all sorts of flyers and all sorts of things to do with media works, you name it. They are extremely helpful, and they have given me the platform to bring you these very interesting topics. So let's carry on with the management or the treatment of cervical cancer. So we did mention about radiotherapy. We mentioned about chemotherapy. Are there any other treatment options?
Laser beam therapy. Laser beam. It is introduced into the cervix to kill off the cancer cells in the cervix. And we have surgery.
And then surgery.
Surgery, depending on where the cancer is affected. You can have radical hysterectomy. You take the uterus and the cervix.
You may have to talk through these big terms, you know, what they really
radical hysterectomy is when they will take the cervix and the uterus out. This means that the cancer has advanced, gone into the cervix. So they will take the cervix off and part of the vagina off.
Part of the vagina as well?
Yes. And there's another one called trachelectomy. This one is like the radical hysterectomy, but this one they will take the bladder, the rectum, the fallopian tubes, and everything off. So this one is a major operation, and it's when the cancer has advanced. And it also depends, usually such surgery will depend on the age as well, and the health being of the individual. If you're not too healthy, they might not do the surgery. But then even if they give you chemotherapy, it's for palliative intent, not for curative intent.
Wow. Wow, that's full on. Right. So there are a few people who say their children had it. See? So I have Catherine Boche is saying, my daughter had the vaccine. It's good to know that our African parents or our African children are taking advantage of some of the treatments or preventative measures and going in for the vaccines, because obviously I know how difficult it was to convince anyone to go for the COVID vaccine, for instance. So that is great to know. Martha Nugent is saying very useful information on signs and symptoms, more emphasis on early detection. How do we initiate this conversation with our teenage daughters? Thank
that
you.
Is the thing. You know, our daughters are our friends. They become our friends. So just start slowly. Ask them, what do you know what the cervix is, or do you know what the vagina is? Slowly, just to, you know, sometimes we underestimate our children.
Yeah.
We think they don't know, but let me tell you, when we were young, we didn't have internet, we had nothing. We had only books. We learned all these things in the books. But don't forget, these guys have internet, they have so many things.
They are more well informed.
They know everything that we think we know. You'll be surprised when you start the conversation, the things they'll come up with. So start slowly, ask them. And you'll be surprised. They will give you everything they know. And what they don't know, as a mother, you top them up.
You top it up. So very important to have the church, youth ministry, youth teachers, and then the mothers can also have all these sort of conversations. I mean, we talk about hypertension and diabetes and stuff like that. These are conditions, and I guess we can't talk about sex as well, for sure. You see, it's funny because when our daughters, when we mentioned about sex, for instance, and whether at our age we are still engaged in sex, my goodness, like when I mentioned this and my daughter is there, it's like, ew, like,
ew, exactly.
I hope you guys are not doing things like that, you know. Yeah, and it is so funny. It is so funny to see the expression, and it's like, stop it, don't do that. But maybe if they knew that it was a diagnostic
tool, they
will get to that stage, and then we will see what they do. Right. So let's carry on with the treatments, guys. But whilst we are excited and whilst you are all into this, let me have a breather. So this year I have been selected as part of a team to go to Ghana with the Trailbridge Foundation. I know some of you are watching, and I am so over the moon and excited about the whole mission. And what we are going to be doing in Ghana is offering training. On another session, I'll bring the Trailbridge Foundation members here, so we talk through the Ghana Mission 2022. But it is not a money-making mission, and actually it's a mission that is funded by those of us who are going for the mission. So guys, I will be needing your help, and I am so going to be into this. In other sessions coming up, I am going to be showing you some of the conditions of our hospitals in Ghana. Some of the equipment you have transported to Ghana and which are just gathering dust because there are no training sessions to accompany these equipment. So guys, I am super excited. I know the Trailbridge Foundation members are watching, and all I will say is that we will be coming around and doing a lot of fundraising activities just to support our missions. So I will be knocking on your door soon. Everyone get ready to sponsor us, to sponsor me and every single person in our team. And it's so exciting because surely if we can go back home and spread the word and do practical stuff with those who are practicing in Ghana, surely we will save lives. And it's not the first mission, it's about the third mission, and I'm privileged to be going on it. So yeah, just by the way, so just watch out. And in future sessions, I will be sharing bank accounts and doing a lot more communication. So if you want to contribute towards the activities of the Trailbridge Foundation, going on the mission to Ghana in September, you will be pleased to just donate and help us. So this is just by the way. So let's carry on. I'm super excited with that one. Let's carry on and see. Radiotherapy, chemotherapy, and then the ones you said. laser beam.
Yep.
Right.
And then the surgeries. Yep.
Right.
And then with chemotherapy, we have something called immunotherapy. It's like a chemotherapy, but it's built up your immune system to fight the cancer. And then we have targeted therapy that also is targeted at some cells or stage of this division of the cells to kill their growth and then shrink the cancer as well.
Does it matter what treatment you have depending on what stage the cancer is?
Yes,
it does.
Yes. But most of with the first stage, usually they will give you radiotherapy depending on how. And then the second and the third, fourth stages, you're gonna have chemotherapy. Definitely.
I see.
Chemo with radiotherapy or chemo and after radiotherapy.
I see. Gosh, it's such a lot to take in for any individual, isn't it? Yeah. Right. So AC Hammond says sponsorship assured for a humanitarian mission. I know.
Tagging along.
Yeah, tagging along. I know. I can always count on her. Hannah Blay. Oh, great. Well done. Thank you. Hannah Dikoski is watching, and I know she's a proud Morgan. Thank you for all the support, and thumbs up to all Morgans on the great event you had recently. A charity event which is going obviously to help educate the female child, and I think that is also a wonderful idea. So let's see if there are any more contributions from here. So I can see Dr. Jampo saying the cervical screening program in UK starts from age 25 and finishes at 65. I say I wonder why it finishes though. It is 3 yearly till 49 and then 5 yearly afterwards. I see. If high risk HPV is detected, then smears are offered more frequently. That is yearly till the virus clears. I see. Hope this has not changed. Has it changed?
It hasn't changed.
It hasn't changed.
Because COVID happened, everything is a bit slow.
Distorted the whole program. And again, he's saying that folks, cervical cancer is a horrible disease, and generally, like all cancers, it is indeed horrible. Please, my sisters, our wives and our daughters, age 25 and above, do not joke with your smears. Judith, great job. Thumbs up from a gynecologist. So you are doing amazing. And Constance Nipa calling, contributing all the way from America, and she says, love this girl. Thank you. And Alberta Kukwabu, amazing job. These are all Morgans who are watching, and I cannot emphasize your support enough. So let's continue with the treatment options. Pelvic extenuation.
Yeah,
what does that involve?
That's also a major surgery. Everything is taken out. Everything, yes.
The whole reproductive.
Yes, everything, including the bladder, the bowel, the fallow, everything.
How will the person survive then?
That's the thing. So all these would depend on the stage of the cancer. And I can chip in as well. We were talking about educating our daughters and the girls. You know, multiple sexual partners. When our girls are young, they think they are beautiful, so they can have how many men, but forgetting that they are exposing themselves to cervical cancer. So we need to speak to our daughters. Slow down, because it's going to catch up with you someday. How many men do you need in this world? How many men do you want to have sex with? I mean, come on. At the end, you are the one suffering, not the men. And where our service is to, whenever you have sex, you know, there's friction and everything. So definitely. So please.
Yeah. I mean, saying that, I have to chip in and say that the diagnosis of cervical cancer does not mean the person has been promiscuous, isn't it?
No.
Because when sometimes we generalize, people will think, oh gosh, they have cervical cancer and then they were promiscuous. It's not like that at all, but then it predisposes you to being at risk of cervical cancer. So targeted therapy and immunotherapy you have mentioned already, isn't it? Are there any alternative treatments? Surely people always want to know whether there are alternatives.
Whatever treatment they're going for, whether chemo or radio, some also use diet. Cancer patients, they talk among themselves. Oh, I think I had spinach and I think it did this to me. So they will spread the information. So they also go and try spinach. With colon cancer, I know red meat aggravates it. So red meat is not a... And then cutting off sugar, because cancer cells love sugar. Anything sweet, cancer cells go for it. So when you are diagnosed, they minimize their sugar intake. So these things are not good for... If you are treating cancer. So
you have to watch your diet.
You have to watch your diet. And with your fruit and your veggies needs to be washed properly.
I see.
Needs to be washed properly.
Great. I think we are doing well, and we are doing well for time as well. So keep your questions coming in. We are getting to the closing stages of the session. But diet, herbs, any other treatment options?
Some also use acupuncture.
Acupuncture.
I don't know how that works, but some people use acupuncture. I mean, I think it's because of the pain they go through, just to relieve them of the pain as well. But I haven't met patients who have used acupuncture with the treatment they are having. And I can also say there are some people who are at risk of having cervical cancer, those who have it in their families. And between 1938 to 1971, there was a drug called DES, diethylstilbene, that were given to women to prevent them having miscarriages. So if your mom had that drug at that time, you have a higher risk of having cervical cancer.
The pregnant women?
Gone are the days, yes, the pregnant women. It was given to women to prevent them having miscarriages. So if your mom has had that drug before you were born, you have a predisposition there.
Unfortunately for us, we don't even know our family histories, let alone know what our moms had.
That's the thing.
Because we don't talk about these things. So it is going to be very difficult, isn't it, to pick up some of these things. Who is at risk then? I mean, this we should have probably asked earlier on. But then now you have all of the information and you have the chance to make choices and informed decisions. Who is at risk?
We are all at risk.
We all are.
So we just have to go for our pap smears and examine ourselves and things. Anything that we see unusual, we have to run to the doctors.
Run to the doctors, right? Okay. And so what general advice will we give? I've seen a few other people joining in. You are a bit late because we are right towards the end of it, but it has been an awesome session so far. We have looked at the predisposing causes, we have looked at early diagnosis, we have looked at trying to examine yourself periodically to check for your cervix. I remember back then when we were training as midwives, and more so when we were training to teach people how to feel for the loop. We said that if you are not sure whether where you've touched down below is your cervix, feel for the tip of your nose.
It's very soft like that.
Feel for the tip of your nose. Guys, this is from my archives back in the day when I was a midwife, and it's very easy to relate when you can feel something, and I remember they said, just feel around your nose, feel how soft and smooth your nose is, and when you touch just the tip of your nose and press it in, it feels like there's a hole in there. It feels like there's a hole in there, and that is exactly how your cervix feels like. And the hole in, so the women who were training, or the mothers, were meant to feel for the thread of the loop. To check that it's in place. And they were meant to just touch the tip of their nose. So this is from my midwifery days, but it is just very little information. And please, ladies, we are trying to slave for these men, but then if you should get this condition, you are going to be suffering the treatment all alone. Yeah. So if we can, one day I had an infection control teaching session, and the gentleman who delivered the session actually brought some UV light and put our fingers through it.
Yeah.
And we could see all the dirt on our hand, and even what our rings had picked up, which our naked eyes couldn't see. Yeah. So from that time, I mean, I would like to slay whichever way, but my fingers, they are never going to be nice. One, because of my job, I have to wash my hands all the time. And two, because there are so much that we harbor down there under our nails that we cannot see. But if we are going to visit down below regularly to do these checks, we really need to get rid of some of these. Every now and again, it's fine.
It's fine,
but definitely not all the time to have nails like claws. Yeah, because you may actually not have a problem, but you may be introducing infection down below yourself, or be causing further bleeding if there is any problem down there, because there is a very rich supply, down below. So let's see. Helena Kotai is watching. Rodelyn Graham, we've been here since the beginning. Okay. Yeah, so that's great. Karen Billington, you are also watching. And AC Hammond said, great show, ladies. Ever proud of you. I'm duly educated. Dr. Bright says, as with all diseases, early detection is key.
That's it.
If detected early, cervical cancer is treatable. Exactly. So get your smear test as soon as possible before it is too late. Do not ignore the red flags, persistent bleeds after sex. My over 50s. We need a session on that one. We have to keep going in that department, guys. We don't really have much of a choice. Do not ignore the red flags. Bleeding in between periods and sometimes unexplained deep pelvic pain could be the red flags you were looking for. And then Karen says, looking forward to Winnie joining the Trailbridge Foundation on our mission in September. I am so pleased to come to Ghana. We are not going in the cities. We are going to work. We are going to do training sessions. And if there is anything I have been excited about in my entire life as a nurse, I think this is it. Exactly. This is it, going to help people to get the necessary training that we need to help our people and to save lives. Yeah. So that will bring us to a very interesting session, and I cannot thank you enough for coming as usual. My twin, she doubles as my twin, my twin sister. I am so thrilled. Kwesi Kwetu, you are watching. I'm sure you are watching from Ghana. Yeah. Abba Jacobs, before you kill me off, I have seen that you are here. If there are so many other people I haven't seen, guys, keep sharing. I'll let Mrs. Kujo round up for us. And then I will also round off. So in summary,
we've talked about cervical cancer. Women, we need to have our pap smear whenever the GPs call us. We need to keep down below clean. We need to speak to our daughters, advise them, multiple sexual partners. What do they need it for? They need to be, come on. We have to talk to our daughters. We need to, as mothers, we have to be their friends. We have to guide them. Sometimes they don't know. Peer pressure. My friend is doing it, so I have to do it. They don't know. Speak to them. Make them your friends and speak to them. Advise them. Any unusual thing that you see, down below is very important to us women. So please, anything, any foul smell, any discharge, any bleeding, unusual bleeding, seek help. It might be nothing. So just seek help, and we all want to survive and beat this cancer for once.
We want to beat this cancer for once. And on that note, I am so proud of you, my twin sister. And we had a little break, and this is the beginning of a whole series of topics coming up Today we have looked at cervical cancer and we have given a lot of advice to our women. Keep your fingernails short. Occasionally, if you want to have it long, then that's fine, but only occasionally. Let's watch our personal hygiene. Let's advise our teenage girls to go for the vaccine, just to prevent. Let's keep examining ourselves. Let's keep making our husbands happy, whichever way it may help you in your diagnosis or your partners. The next time we come here, which will hopefully be in 2 years, in 2 weeks. In 2 weeks. Oh, surely not 2 years.
No way.
In 2 weeks. I've got a number of programs lined up. So some of the topics coming up are basic life support. Do you really know what to do when a family member chokes or when they suddenly collapse? We will be looking at that. And then we will also be looking at social work. We hear about people having their children taken away from them all the time. Do you know what predisposes you as a parent into getting to that stage where your child will be taken away from you? We will also be looking at dementia. And all these are very important topics. Deep vein thrombosis, which can lead to sudden collapse. These are some of the interesting topics coming your way on Let's Talk About Health. I have thoroughly enjoyed the session. Thank you so much, Mrs. Kujo. Thank you, Omega Live and Omega House Multimedia, for the amazing work you do in promoting health in our community. Thank you, Trowbridge Foundation, for including me in your team for going to Ghana on Mission 2022. Thank you to my husband for always bringing me here, chauffeuring me here from Cambridge all the way here to London. Thank you to our producer and to Mami Danswa, our able-bodied personnel who are always here ready to get us live. On that note, I have so much to look forward to. So I'll say keep staying safe and be hopeful. The least you can do if you don't do anything at all is keep smiling. Because I will. Okay, bye-bye. Thank you.